My name is Kara Blackburn and I'm a Women's Health Advisor for Médecins Frontières. So my role as a Women's Health Advisor means that I provide direct clinical support to the fields where we have women's health programs. One of our priorities this year is to actually look at how we can increase services for the prevention of mother-to-child transmission of HIV. So what we're trying to do is develop protocols where we don't have a HIV program, but for women who are HIV positive during their pregnancy, to give them the medication that will reduce transmission to their child. And that of course can happen during pregnancy and particularly during delivery in the postpartum period. So what we're really trying to do is look at ways of simplifying protocols, of making medication available and training staff in the care of these women. So in, for instance, places like we've got a mother and child project in Bougainville, in the south of Bougainville at the moment. HIV prevalence there is sort of a medium to high level, but we don't have a HIV project there. But what we want to try and do is look at ways of providing HIV care, particularly prevention of mother-to-child transmission of HIV in a very small hospital. In a lot of our interventions, in fact, Médecins Frontières responds to natural disasters, not only just to conflict situations. And what we do find is that in these circumstances, in natural disasters and in conflicts, that a large proportion of our affected population is women and children. And of course, as you can imagine, during a natural disaster or even a conflict, women continue to become pregnant, they continue to need assistance for delivering their babies. And so, you know, it's absolutely necessary and an absolute requirement that we make sure that in our interventions that we have the ability to provide safe care for these women, because if there is an earthquake, it doesn't stop women going into labour and having babies, and we need to make sure that in our interventions that we have the appropriate care, the appropriate facilities to provide care for these women. In a lot of these situations, in fact, women are very vulnerable. They're already vulnerable because they're women, and then put a pregnancy on top of that, and they are really, really at risk for a lot of complications. And so that's why, you know, we really need to have a strategy of being able to provide the appropriate care during these times for women that need our assistance.